Okay, good afternoon. Can everybody hear me okay? Great. Good afternoon, everyone. My name is Suerie. I'm the Director of Research of the Global Health Center here at the Graduate Institute of Geneva. It's my pleasure to welcome you all and to chair this afternoon's event. I would like to first welcome all of you here and thank the organizers of the event for giving me this opportunity. That includes the Secretariat of the UN Secretary General's High-Level Panel on Access to Medicines at UNDP and at UNAIDS. Of course, we have with us the co-chair of the panel, as well as panel members and members of the Expert Advisory Group, the South Center, and the governments of Bangladesh, Brazil, India, and South Africa, some of whom are represented here on the panel, and others are in the room. Before jumping into the substance of the discussions, I just wanted to make a few very brief remarks to provide a little bit of background on the report and how we got to where we are today. So the initial idea for convening such a report, convening such a panel came out of the Global Commission on HIV and the Law, which recommended that the Secretary General find a way to remedy the policy incoherence between the justifiable rights of inventors, international human rights law, trade rules, and public health in the context of health technologies. Following on this recommendation, UN Secretary General Ban Ki-moon convened in November 2015 the high-level panel co-chaired by two former heads of state, Madam Dreifuss on my right and President Festus Mogae of Botswana. The panel reported back in September 2016, and the Secretary General welcomed the report and also encouraged member states and other stakeholders to discuss and take forward the report's findings and recommendations in all of the relevant fora of the UN and elsewhere, not only at the UN. I think this is very important to highlight. Why are we here at the World Trade Organization discussing access to medicines? And for many of you in the room, this is not a mysterious question. This is not an old issue. This is not a new issue. This is one that the WTO has been wrestling with and working on for quite a long time. But it is still worth mentioning, I think, the importance of the fact that this panel was convened at a UN-wide level, at the highest levels, in fact, by the Secretary General. And one of the reasons for that was, of course, the realization that health, and access to medicines in particular, is not an issue that can be resolved primarily or only by the health sector. It does require contributions from all sectors, and trade, of course, is one of the really important ones. So this is also the first time that there has been such a UN system-wide high-level panel convened. And the political priority that it has been given, I think, is something that is very important for us to keep in mind as we go through the discussions today. The WTO, of course, is in the midst of a TRIPS Council meeting. I understand that tomorrow, most likely, the high-level panel will be discussed within the TRIPS Council itself. This is not the first time the panel's report will be discussed at the TRIPS Council. It was already on the agenda back in November, and this is very encouraging that the WTO and the WTO members have taken this report so seriously and are dedicating significant political attention to it. One of the reasons why the Secretary General felt it was necessary to convene this panel at this time was, of course, that we are at the beginning still of the Sustainable Development Goal era, and we are transitioning from the MDG era into the SDG era. And just as a brief reminder, SDG 3 is the one that focuses on health, which calls for ensuring healthy lives and promoting well-being for all at all ages. And I think the text of SDG 3 is very important in reminding us that when we say for all at all ages, that what this means is that access to medicines needs to be guaranteed for people in all countries, high, low, and middle income countries, across all diseases, not just a handful of diseases, and of course across all technologies. That is not just drugs or vaccines that are important, but other types of technologies as well. And this is one of the big intellectual challenges that the high-level panel wrestled with. We'll hear more about that from the speakers. But health is not only contained in SDG 3, health is more broadly understood as a precondition, an indicator, and an outcome of sustainable development. And it is, in fact, vitally interlinked with all of the 16 other SDGs. So without further ado, let me briefly introduce who we have on our panel today and go down the sequence of events, and then we'll announce each speaker before they proceed. So first we'll have the chair of the panel, Madam Ruth Dreifuss, former president of the Swiss Confederation, who will be providing us an overview of the report's findings and the process. And next we'll have Salsma Marim, former Minister of Foreign Affairs of Brazil, also a member of the Secretary General's high-level panel and currently chairman of the UNITAID board. He'll be followed by Ambassador Shamim Ahsan from Bangladesh, who will be arriving shortly, and followed by Ambassador Evandro Didone of the Permanent Mission of Brazil here to the WTO. And finally, we'll have remarks from Professor Carlos Correa, who's a special advisor to the South Center and was also a member of the high-level panel's expert advisory group. At that point, we'll pause. Each speaker will speak for no more than 10 minutes. We'll have about 45 minutes for reactions, comments, questions from all of you before we close by 3 p.m. So without further ado,
Thank you so much, Suerie. You didn't mention that you were also a member of the expert advisory board and very helpful for the work of the high-level panel. You introduced the nature of our panel, and I want to make some remarks on the mandate we received from the General Secretary. On one side, it was a very broad, and on the other side, a very narrow mission that we had. Narrow because, as you heard, we had to concentrate and to focus on the tension between intellectual property rights and the right to health. On the other side, it was very broad because it was a mandate that, on the way working with it, we saw that it was no longer what it was perhaps 10 years ago, a problem of the poor country, a problem of transmissible disease, and an issue of just speaking about medicine and vaccines. In other terms, during these 10 years, the problem of the access to medicine became a real global problem, and not just for the poor country and transmissible disease. On one side, we know now that the burden of disease is higher for not transmissible disease. And these are exactly the disease where the cost of new medicine is the highest today. I mean, we know how to deal with transmissible disease. We learned quite quickly to deal also with the new epidemics in this field. I mean, HIV, for instance. But the medicine for cancer, the medicine for neurodegenerative disease are those who are now the biggest challenge for the countries, and I would say for all countries, for all systems, not only for countries where you pay out of the pocket for medicines, but also countries with universal coverage, but having now the difficult challenge not to introduce rationing of health services to their population for the price of these treatments. It is also a global focus that is important, not only to look at medicine and drugs and vaccines, but as important is the issue of the diagnostic and of medical devices. And if I can say from my experience as Minister of Health in my country for 10 years, the whole package of medical devices was more neglected in the political view than the medicine and drug issue. And the prices of these medical devices are more influenced, if possible, through the patent laws that they are ruling, and the link between medicine, drugs, and the medical devices has also brought the prices of some treatments on a very high level, in the sense that even drugs who are no longer patented, because they are delivered through medical devices, will be patented and at very high prices. So that in this sense, our view was a very large view concentrating on the other side on our mandate. In the short time I have here, I would not present all the recommendation you receive, and you know that our report is also available in different languages, but you will see in this report that our recommendations are one on the development of the research and development of new medicines. It is on the intellectual property laws and access to the health technologies, and my colleague Sergio Amorin will speak more about that. It is about new models, new incentives for research and development, and this is something that is mainly in discussion now, should be in WHO. I will just insist on the last chapter of our recommendation on governance, accountability and transparency, and focus on the issue of transparency. Transparency is in a system where you have a very strong collaboration, I would say, between public and private. I mean, you have on one side the financing of basic research made by the public hand in general. You have R&D made for some kind of medical technologies by public hands. Vaccine, for instance, was developed mainly under public financing. On the other side, you have the important role of the pharmaceutical industry in this field. And you have the whole system of regulation and procurement, where the public hand is also acting in the access, in the promotion of R&D, of development and access of medicine. And when you see this whole chain, and when you think that in the middle there is a black box, the black box of not knowing what are the prices, what are the system of production of new knowledge inside the pharmaceutical industry. So that I think one of our boldest and strongest recommendation is to put light in this black box. It is important because it allows also to know why some needs are not covered by the pharmaceutical industry. On the other side, it is absolutely important to guarantee that the negotiation on the price of the medicine between the pharmaceutical industry and the authorities are done in a fair way, and that what is paid by the public perhaps in the beginning of the process will not be paid again at the end of the process through the procurement. So that transparency is in the relation between public and private, I think something that should be really now a new topic in the discussion about innovation and access to medicine. And this is why I wanted to insist here on this recommendation, where we think we brought something very, very new in the discussion. So thank you so much for your attention. I'll give you back the floor.
Thank you very much, Madam Dreifuss. Over to you, Minister Amorin.
Thank you very much, Suerie, and